This video mainly explains the relationship between the dependent variables COVID-19 death per million and the 6 variables we chose as follow. To determine whether the differences in the performance of countries in the COVID-19 pandemic depends on the characteristic of the country before the pandemic or the response of country after the pandemic. At first, according to our daily news and some experiences in our own countries, we agreed that the differences in the performance of country should be reflected in the country's response to the pandemic. But by analyzing the 5 basic variables, over 16 5-years-old population ratio, Gini, GDP per capita, urban population, and opposite rate, we found that the characteristic of country before the pandemic do indeed play a decisive role in the differences in the performance of countries. What's more, through our analysis of various countries' government decisions during the pandemic, here we choose GRI, Government Response Index, to explain. It covers 14 factors, and we got a very interesting conclusion. The specific analysis process will be explained by my teammate Ian and Xinhao, and GP will summarize our analysis.
We will now discuss the results for the GRI regression. We can see that when we increase mean GRI by 1 unit, the number of deaths per 100,000 people should increase by about 2.2. This is statistically significant at the 5% level. This positive coefficient is confusing, as it suggests that the stricter the government responses to COVID, the greater the number of deaths by COVID. However, this can be easily explained as a problem of reverse causality. Instead of GRI increasing the number of deaths, it is more likely that the more deaths there are in the country, the stricter the government response will be. Furthermore, when testing the heteroskedasticity in functional forms, we find that the model is imprecise and that our coefficient is indeed in the proper functional form. For these reasons, coupled with low R-squared of 0.14, these regression results will be deemed inconclusive. One way in which we could improve the model to better understand the causal effect of GRI on the number of deaths is to build a more complex model with time series instead of cross-sectional data.
Our data has more than 100 countries in which include a governmental response index and 5 pre-pandemic variables. We can see that our variables can explain more than 50% variation in death rate. Especially, the government response index and above 65 and obesity rate have a significant impact on the death rate. The coefficient of government response index decreased after adding more pre-outbreak variables into models, but is still in a significant way. Not surprisingly, the above 65 are significant due to the characteristic of COVID-19. It is more fatal to the elder people. Moreover, the obesity rate may suggest the lifestyle of residents or how people lay stress on health. So we choose Model 3 as our optimal model.
In summary, our analysis was inconclusive since we weren't able to quantify how important a government's response to the pandemic is when compared to pre-pandemic factors, mainly due to the reverse causality in the GRI. Ideally, we should have created a model where the GRI variable is weighted more towards earlier restrictions, as those are the ones which matter most according to the literature, and it would be a way to not have the reverse causality problem, to overcome it, instead of just using the mean GRI over the whole pandemic period. Regarding our other independent variables, we found that, unsurprisingly, what contributes most how badly a pandemic hit the country in terms of deaths is the amount of elderly people in it. Obesity rates were also very significant, while other variables, mostly economic variables, are very minor or insignificant. For future analysis, it might be interesting to include a variable which relates to cultural characteristics of a country, such as a country's social connectedness, that is, how many people a person interacts with daily. See Milani 2021 as an example of this. Another problem with our analysis is that our choice of dependent variable may also be questionable. This is illustrated by a model where we regress the same independent variables but on COVID cases per million instead of deaths per million, and the amount of elderly and the obesity rates were still the best predictors of this, and this doesn't make sense as these variables only predict the amount of deaths. This leads us to believe that there is a very significant amount of underreporting of both COVID cases and deaths. This underreporting has been explored in literature. See Bateman et al. 2020.